As I blogged previously, and check out all my prior blog links that are relevant in today's link below, the SURPASS-CVOT cardiovascular outcome trial comparing tirzepatide, which is mounjaro, versus dulaglutide, Trulicity, in people with type 2 diabetes found that tirzepatide provided similar protection from cardiovascular events as does dulaglutide. Given that tirzepatide is much more effective for blood sugar lowering, weight loss, and overall improvement in metabolic health, it was maybe a little surprising that tirzepatide didn't perform better than dulaglutide. So, a new post hoc analysis of the SURPASS-CVOT data published in JAMA Cardiology suggests that with more broadly inclusive cardiovascular events, tirzepatide may indeed have performed better. So, now we need to go through some jargon of what is a CV event exactly as analyzed in this study. So, in the SURPASS-CVOT trial, the primary endpoint was a composite of three things: cardiovascular death, non-fatal heart attack, and non-fatal stroke. The trial found no significant difference between tirzepatide and dulaglutide looking at those three parameters together. Now, in the current analysis, authors expanded the CV endpoint criteria and found that with a four-component endpoint, so adding on coronary revascularization, there was a significant 14% greater reduction in risk with tirzepatide. When they looked at a five-component endpoint, now adding on hospitalization for heart failure, again, there was a 14% greater risk reduction with tirzepatide. And looking at a six-component endpoint, now adding on a composite of adverse kidney outcomes, there was a 16% significantly greater reduction in risk with tirzepatide. So said another way, if you treat 27 people with tirzepatide for about 4 years, one of those six events will be prevented. While this study was a post hoc secondary analysis and therefore needs to be taken with a grain of salt, this broader analysis appreciates that people with diabetes and obesity can experience a broad range of heart and kidney issues and does a better job of taking these broader issues into account than the more narrow primary endpoint from the SURPASS-CVOT study, which is the more traditional endpoint of cardiovascular outcome trials. It also does a better job of reflecting the broad benefits that tirzepatide can provide to cardiometabolic health. So the bottom line is that this analysis of the SURPASS-CVOT trial suggests that when viewed more broadly, tirzepatide performs better than dulaglutide to provide heart and kidney protection in people with type 2 diabetes and cardiovascular disease. As a disclaimer, I am or have been an investigator of clinical trials with both tirzepatide and dulaglutide. I receive honoraria as a continuing medical education speaker and consultant from the makers of both medications, which is Eli Lilly.